Kia ora everyone, I'm Benji. I used to work at Positive Woman. Hi Judith. She has a food truck, by the way, which is amazing. This presentation is sponsored by her food truck. But now I'm working at Body Positive as a peer tester. So I'm here to talk about our new innovative way of doing sexual health testing, which is very, very exciting, which is part of the tooting of our own horn. Hey. All right, so I'm obviously, as I said, a peer tester. So why do we need peer testers? Well, it is recommended by the World Health Organization to have community-based peer-led HIV testing. Why? Well, there are numerous studies actually showing that peer-led interventions are highly effective in increasing HIV testing rates among men who have sex with men, and NGOs is well established, highly successful in New Zealand, especially when it comes to HIV testing. Here are some examples of peer testers in New Zealand. We've got, again, Positive Woman. Hi, Judith. Burnett Foundation. Hi, Rodrigo. We've got Body Positive, Toi Tu Te Ao, which is mainly based in Rotorua, Waikato area. We've got the New Zealand Prostitutes Collective, which is under a different name now. What? Thank you. And ADIO Trust, which is a needle exchange program. As you can see here, we don't actually have a lot of cities, towns that actually do peer testing. They're mostly in the main centres of Auckland, Hamilton, which is part of the Rotorua area as well, Wellington and Christchurch. But the thing that shocked me is that we don't have places where peer testers in like Dunedin, where they have obviously university, or even in Palmy with Massey University, and things are really going off in Palmy at the moment, so nothing else to do in Palmy. If you want to know what, just come find me afterwards. All right, so what is a peer worker, peer tester, or peer support? Well, peer support provides emotional and practical help from someone who has experienced a similar challenge. Shared experiences and characteristics such as age, background, or health build trust and understanding. Being accepted into a person's social circle enhances connection, offering a level of empathy that professionals may not easily achieve. Not to say that you can't achieve it, but similar experiences is easier to have that. Here are some examples of peer support. We've got Rainbow Youth, Outline, Mapu Maya, who I used to work with Positive Woman. Hi, Judith. I try not to do that too much. Emerge, Aotearoa, etc., etc., etc. Now, if you go to HealthPoint, there are over 200 services that are peer support services. I can't see why any of those 200 plus 200 services can do HIV and STI testing with them. All right, so about the new innovative way of sexual health testing. How did this came about for us? Well, Te Whatu Ora put out a request of proposal to expand an innovative way of doing HIV and STI testing. I believe someone's going to talk about that a little bit later. Yep. So I won't go too much into detail, but what they are looking for is increased access to and uptake of testing for HIV and STIs in priority populations, reduce stigma associated with HIV and STI testing, reduce number of new locally acquired HIV infections, improved Maori health and well-being in relations to HIV by delivering on our Te Tiriti o Waitangi obligations, and improving surveillance of HIV and STIs in New Zealand. Here are some of the figures currently. I know that there's the sexual health conference tomorrow, so they're going to go more into detail about that. So I'm just going to brush upon this. We've got 774 new cases of syphilis in 2024, which is increased from 2023. Gonorrhea cases, 7,581. Chlamydia, 27,684. As Sue pointed out before, HIV, 95 new cases. AIDS, 28 new cases, which is double from last year. Shingilla, 162 new cases, and Mpox, 23 new cases. Given the increase of STI transmission rates in New Zealand, there is a clear need for more accessible, timely and effective STI testing, treatment and prevention services. Strengthening these services will help reduce transmission, support earlier diagnosis and improve on public health outcomes. So far, Australia, great Australia, has made a statement declaring syphilis a communicable disease, which is something that New Zealand has not been able to do yet. So far in Australia, they have 3,546 new cases, and they're on their way to beating last year's cases. This also includes 11 cases of congenital syphilis, passing on to the child, and 4 of those cases of infants end up dying from syphilis. Now, you will see pregnancy rates. What I'm here to talk about here is about missed opportunities. A study released in 2009, only 64.3% of women were getting a full sexual health screening, which is not a big number. Now, you might be asking, but that was 2009. You might also be thinking to yourself, damn, Benji's so handsome. I like to put in a joke here. But between 2017 and 2024, 57% of women who were tested positive for syphilis, pregnant women by the way, had no or late antenatal care. Now looking at all that number, all these 2 numbers, none of these people have had an HIV test. Talking more about missed opportunities, I believe someone else is going to talk about missed opportunities later today as well. I saw it somewhere on the program. Oh,
yes, you're right.
Cool. Thank you for the support. But yeah, in New Zealand, 25% of chlamydia and gonorrhea tests are conducted on males. So let me just change that in a way. If we had 20,000 people getting tested today, 75% of that 20,000 people are women, which means 25% of those are men. Very, very low number. And as I said about men earlier, men are arseholes. Sorry. In a study done by Sexual Wellbeing Aotearoa, 63% of people say that a health practitioner has never discussed STI tests with them. That is a massive number. In a study done by, the same study by the way, by Sexual Wellbeing Aotearoa, 33% of people say that STIs were not covered as part of their relationships and sexuality education in school. Now, changing it to men who have sex with men, 58% of gay men are not out to their health practitioners. Big number. 47% of rainbow people do not feel comfortable even talking to their GP about sexuality, gender identity or STIs. So there are some big missed opportunities here, which, as I was saying before, there is a need for peer testers so that gay men can feel comfortable about when it comes to testing. All right, what are we doing at Body Positive? Currently, we do rapid HIV and syphilis testing for everyone. We do hepatitis C testing for everyone. However, the swabs and urine tests that we do for gonorrhea and chlamydia, we have only restricted access to particular priority groups. So not everyone can get them. And of course, we have to send them off to the lab, which takes a couple of weeks. Part of that sexual health testing with chlamydia and gonorrhea, we have to say no news is good news. On top of that, we do a system where it's for community by community testing. Now, at Body Positive, so far this year we've done 447 HIV tests in-house. This is not including when we go out to the communities. 40% of these are done on gay men. 42% is done on straight people, and 18% covers that other minority. So we already have a bit of a focus on men who have sex with men as it is. It kind of shows in our figures already, so yeah. So when we looked at innovative ways of doing sexual health testing, we wanted to see what we can do. We look at what's happening overseas. We have a case study here that was done in London. This place is called the Dean Street Express. Now, with them, compared to standard sexual health clinics, Dean Street Express offers a rapid sexual health testing services for asymptomatic infections. This service delivers fast results for chlamydia and gonorrhea, enabling early treatment, shortening the infectious period, and ultimately reducing transmission rates. So Body Positive are aiming to do what they are doing. Now, the difference between what Dean Street Express does and what a standard sexual health clinic does is that Dean Street Express do all their testing in-house. They're not sending it out to the labs and wait 2 weeks for results. They're doing it in-house. All the testing is done there. Now, comparing with what Dean Street Express is doing compared to the standard sexual health clinic, the standard one is 56 Dean Street. Dean Street Express delivers results within 24 hours, mostly within the first couple of hours. Now, if you compare that to a standard sexual health clinic that sends it off to the labs, on average, they do it around 9-10 days, but they mostly deliver results within 7 days. But as you can see, there's even some people that are not getting their results until almost a month later. Yes, wow. So we're wanting to do in-house testing compared to what standard sexual health clinics are. So, beginning from September 4th, I hope we're going to be doing it. Yep, I got the nod from Mark. Beginning from September 4th, Body Positive, in collaboration with Auckland Sexual Health Services, will offer chlamydia and gonorrhea testing using GenExpert technology, providing results to us within 90 minutes. But our aim is to provide testing results to the patients within 24 hours, regardless if it's negative and positive, either by text if it's a negative result, or phone call if it's a positive result. Very exciting. The service expansion includes extended clinical hours, allowing for same-day testing and access to PrEP and Doxy-PEP, enhancing the convenience and timely prevention for patients. And this service will be peer-led services by me and other peers, which will be supervised by the nurses. Now, if there's any nurses out there that want a job, we're looking. Or if you know someone that, any nurses that wants a job, we're looking. We're also moving to an opt-out model. So usually how things have been doing is that patient comes in and they have to ask for a test, a sexual health test. Now we're going to automatically give them the sexual health test regardless, and if they don't want to do the test, they just request not doing it. So we're making sure everyone's going to get tested, everyone that walks in. So our ambitions. Our ambitions is to have a full-range sexual health testing service. We're going to do some vaccines as part of with the nurses, which will include Mpox. We want to do anal cancer screening, hepatitis C testing and treating, a PrEP clinic, a PEP clinic, and treatment as part of with the nurses. Now for marketing, so this is just an example of potential posters that we'll be using. We aim to market clinic by using billboards in the city, press releases, social media advertising, flyers and promo material, and approaching and building relationships with the local businesses like hostels, GP offices, sex and site venues, etc., etc., etc. Yeah. Why is this important in a New Zealand context? Well, we're obviously getting high cases of syphilis, chlamydia and gonorrhea. What Mark likes to tell me before is that we've got high cases of syphilis in Auckland, that we're getting to the point of calling us, instead of the city of sales, that we're the city of syphilis. You saw that coming, didn't you? It's not the best marketing campaign, but we'll take it. Not only are we seeing high numbers with men who have sex with men, but we're also seeing high numbers in Māori and Pacifica communities. Previously, when I was talking about those figures with all the sexual health, syphilis, chlamydia, gonorrhea, etc., 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 that does not show how many people are not being tested, apart from the fact that the men are not getting tested. because men are assholes. Sorry. Where was I? We are also receiving this is the shocking thing for me. This is the biggest shock for me personally. We are receiving positive STI cases for as high as 178 for the ages under 14. Now, let's combine that with everyone under the age of 19, 6,664 cases of STIs in New Zealand for everyone under the age of 19. That's the shocking thing for me. So again, missed opportunities with MSM, men who have sex with men, are 86 times more likely to get syphilis than men who have sex with women. So, our focus is with men who have sex with men. We will offer free and confidential STI testing for everyone in the rainbow community with a focus on men who have sex with men and people who are living with HIV. However, we're not the type of people to show anyone away. Or, we will test everyone. If anyone in this room wanted to come get a test, we will do a test, no matter what. No questions asked. Well, some questions, but yeah. Appropriate questions. All right, what we hope to achieve is increased testing for HIV and STIs, shortening the time patients wait to receive their test results, notifying the patients of their results regardless if it's positive or negative, providing faster treatment for HIV and STI patients, reduce anxiety surrounding testing, reducing transmission of HIV and STIs, reducing human error from testing which can be seen in self-test kits, provide status-neutral conversations through our peer testers, and make HIV, STI, and STBBI testing available to everyone regardless of ethnicity, sexuality, gender identity, visa status, and income status. How does this help you, the medical people? Well, we're putting less pressure on the health system because they're coming to see us instead of seeing you. We're increasing access and uptake of STI and HIV testing to priority populations and to everyone. All positive tests results will be seen by the nurse that's in site, or our ASH's nurse. With this peer-led program, we will reduce stigma associated with HIV and STI testing, and we're reducing locally transmitted local transmissions. And because I'm just freshly out of university and we're graduating in 2 weeks, this is fully referenced. All right, Mark's favourite part, questions. We've got one person over there.
What do we know about methamphetamine subculture and its influence on these figures?
That's a good question. Is the Drug Foundation here? No? Do you want to answer this one?
There's an increase, can I answer?
Yeah.
Sorry. I mean, for some of you have seen the work from Peter Saxton on how people use methamphetamine for gay and bisexual men. I work in, as I said, I work in CAT. And we are seeing an increase in sort of promiscuity because when you take meth and you're on top of the world, you want to sleep with the rest of the world. And unfortunately, currently in the service that I work, there is no, as up to when Mark came to us, they didn't talk about sex. Because culturally, especially for Teatro Marino, so really for Pacifica, for Tupu, it felt that it was not part of our core business. So despite the fact that we have the Hep C initiative and there's lots of things happening, nothing was happening so just to give you an idea, we see 12,000 patients a year. The majority of the clients that come to our doors are seen by clinicians, by counselors. That means that they're not seen by doctors. So what I'm trying to say is that the medical service is not equipped, neither are addiction services or at primary care level. Because as you can see, we have one of the lowest rates of GPs. So methamphetamine is not just methamphetamine alone. We've seen an increase in polysubstance use. So that means that it's not only men who have sex with men, but I'm seeing an increasing number of women who are using G. A lot of cannabis and medicinal cannabis going up. Alcohol continues to be a big problem for us, and not a lot of information. We are seeing heroin as well, and we are seeing an increase in IV use. So I think all the drugs, we don't talk about drugs in this, but Mark has changed the narrative by CATS. And I'm so looking forward to see what they do. I wish I could have that thing in my service. But yeah, so we need education. We need to teach kids. And
At what point would you see that changing? How bad does things have to get for you to actually get some form of recognition of that?
I think it's bad enough already. How
So who's blowing the whistle?
we all are, but we all are. It's just we need more funding and education. As you say, what we see in kids at the moment. How many of your kids have been taught harm reduction in school?
Not enough.
None, right? How many of your kids have been taught about STIs? They get taught how to use a condom, which they forget. Yeah, because they are so excited, right? You just first, love. Sorry, I overtook. Sorry.
One thing I'd like to add is that we do actually do a lot of outsourcing when it comes to test. Not outsourcing, we go out to the communities a lot when it comes to testing. We go to sex on-site venues. But one thing that we do see that's quite successful is that we go out to CADS in Monaco, and we see quite high testing numbers there as well, which is amazing because conversations surrounding HIV in Māori and Pacifica communities can be quite taboo sometimes. It's like one of those things that we don't discuss. But yet, we're going out and testing there, and we're getting lots of numbers by Pacifica and Māori that are wanting to get a test there. I also, when I was working with Positive Women, we did a similar thing with some on churches, and again, big, massive testing coming out there. Hi, Judith. So, those things. Right.
I just had a question about the anal cancer screening. Sorry. I just had a question about the anal cancer screening. You're talking about digital anal rectal examinations, because...
It's an aspiration. So one of the things they do at HQ Toronto, which runs a similar clinic to that, they do anal cancer screening, but they have HRA available. But they're doing smears, and then they're doing DARE based on that. So it's about. So the idea is, if we get HRA here, could we be a pathway for that? And so the idea is, like, a lot of people come to us for HIV testing, and because we're a safe, convenient, confidential kind of community space. So how do we get anal cancer screening happening in New Zealand, because it's not happening, and it's going to be a huge issue with the HIV population with MSM, and at the moment there's no movement. So we're kind of, there's a separate process we're doing around pushing for anal cancer to become a much more topical thing and to potentially get HRA. And when that happens, we want to be on board with this clinic to be able to provide that as part of the process. Because people come to us for an HIV test, right? That's why they come. We want to make it more robust in terms of Mpox vaccines and all those other things, because it's, it's convenient. We're on Cape Road, right? So we'll get a really different group. So I think, how do we maximize that benefit? So it's an ambition. We want to do anal cancer screening because it should be happening. All right, I think we're good.